Medical coding is like solving a puzzle. Imagine you go to the doctor. The doctor examines you and makes notes about your visit. Medical coders take those notes and turn them into codes. These codes tell a story about your health. These codes are very important. They help doctors, hospitals, and insurance companies understand your health information. Medical coding ensures everyone is on the same page when it comes to your healthcare. Just like there are different types of doctors, there are different types of medical coding. These are called medical coding specialties. Each specialty focuses on a specific area of medicine. Medical coders play a vital role in the healthcare system. They are like translators between doctors and insurance companies. Doctors use medical terms and procedures that are hard to understand. Medical coders simplify this information using codes. These codes help insurance companies understand what treatment you received. This ensures that you receive the correct coverage for your medical expenses. Medical coders need to be detail-oriented and have excellent analytical skills. They must stay updated with the latest medical advancements and coding guidelines. Their work ensures accurate billing and reimbursement, keeping the healthcare system running smoothly. Cardiology coding focuses on the heart and blood vessels. Cardiology coders work with complex procedures like heart surgeries and pacemaker implants. They use special codes to describe these procedures accurately. For example, imagine a patient undergoes a coronary artery bypass surgery. The cardiology coder assigns specific codes for the surgery, the type of bypass used, and any additional procedures performed. Accurate coding is crucial for insurance claims and medical research. Cardiology coders ensure that hospitals and doctors are reimbursed correctly for their specialized cardiac care. Dermatology coding deals with the skin, hair, and nails. Dermatologists treat various conditions from acne to skin cancer. Imagine a patient visits a dermatologist for a suspicious mole removal. The dermatology coder assigns codes for the examination, the biopsy, and the type of lesion removed. These codes help track skin cancer rates and the effectiveness of different treatments. Accurate coding in dermatology is essential for both patient care and public health initiatives. Section 5. Emergency Medicine. Coding racing against time. Emergency medicine coding is fast-paced and demanding. ER coders work with a wide range of medical emergencies. They need to quickly and accurately code for treatments given in the ER. For instance, if someone arrives at the ER with a broken leg, the coder assigns codes for the X-ray, pain management, and application of a cast. Their work helps hospitals track the types of emergencies they handle and allocate resources effectively. In emergency medicine, every second counts, and accurate coding ensures prompt billing and patient care. Section 6. The significance of specialized coding. Specialized coding is crucial for many reasons. It helps track the effectiveness of different treatments and procedures. This data helps improve patient care and develop new medical technologies. Specialized coding also helps insurance companies understand the complexity of medical procedures. This ensures that doctors and hospitals are appropriately reimbursed for their specialized services. Moreover, accurate coding helps researchers study disease patterns, treatment outcomes, and healthcare costs. This information is vital for making informed decisions about healthcare policies and resource allocation. Section 7. Career paths in medical coding. A career in medical coding offers stability and growth opportunities. There is a high demand for skilled medical coders in hospitals, clinics, and insurance companies. With experience, coders can specialize in areas like cardiology. With experience, coders can specialize in areas like dermatology. With experience, coders can specialize in areas like emergency medicine. They can also pursue certifications to enhance their skills and earning potential. Medical coding is a rewarding career for those passionate about healthcare and making a difference in people's lives. Section 8. The evolving landscape of medical coding. Medical coding is constantly evolving. New medical technologies and treatments emerge regularly, requiring new codes and coding guidelines. Medical coders must stay updated with these changes through continuing education and professional development. Electronic health records and computer-assisted coding tools are transforming the field. While these technologies streamline coding processes, they also demand advanced skills and adaptability from medical coders. Section 9. Conclusion: medical coding, an indispensable pillar of healthcare. Medical coding is an essential part of the healthcare system. Medical coders are the unsung heroes who ensure accurate billing, efficient healthcare operations, and data-driven decision-making. Their specialized knowledge in areas like cardiology, dermatology, and emergency medicine contributes to better patient care, medical advancements, and informed healthcare policies. As healthcare continues to evolve, medical coding will remain a vital and rewarding career path, attracting individuals with a passion for healthcare and a dedication to accuracy and efficiency.